In this lecture, we're going to do a brief overview of the American healthcare system, particularly just understanding the numbers. So, what do we know about the American healthcare system? For one, it's kind of huge, and two, really expensive. So, we can start by understanding that we spend 17.7% of our GDP. So, almost 18% of our gross domestic product goes into covering healthcare. In 2019, and all of these numbers are really all of these numbers are pre-pandemic numbers. We were spending $3.8 trillion, which was almost a 5% increase over the previous year. And that comes out to about $11,582 a person that's being spent on insurance. The federal government pays about 29% of this total amount of expenditure. Private households, another 28%, and this has to do with out-of-pocket expenses as well as what you're paying in insurance premiums. Private businesses, an additional 19%. Once again, that's what your employer is contributing to your insurance. And state and local governments, 16%. Think of this particularly as Medicaid. And that's also going to vary by state, with miscellaneous 7% coming from elsewhere. So where is that federal money going? Partly it goes into Medicare. These are numbers from 2018, I believe, because the dashboard for the government was down. I don't know what's going on with that. So you have really a little over 58 million people, or rather 58,650,132 million people covered at a cost of $672.1 billion. That's a lot for Medicare. You add on to that Medicaid, and you'll notice far more people are being covered by Medicaid. And we're going to talk about the distinctions between these programs more in the next lectures. And so this is 70,632,078 people. Again, those older statistics, for a cost of $565.5 billion. And this is split between the federal government and state and local governments. And then additionally, we have CHIP, which is for children. And you have almost 9 million children being covered by this for a cost of $15.6 billion. Most Americans do get their insurance through private insurance, and that's an additional 153 million people. With the Affordable Care Act, particularly through the exchanges, getting an additional 8.8 million. But that means that there are still a lot of uninsured people. 27.6 million people in 2019 were uninsured, or 10.3% of the population. Sorry, that's 10.9% of the population. In 2019, when surveyed, almost 74% of the uninsured said that they were uninsured because of the cost of coverage. It was just too high. Many people don't have access to coverage through their jobs, particularly if they're gig employees. And some people, particularly poor adults in states that didn't expand Medicaid, remain ineligible for financial assistance for coverage. We also have to understand that undocumented immigrants are ineligible for Medicaid or marketplace coverage. That's the people who are uninsured. But there's another group of underinsured Americans, which we estimate at about 41 million, or roughly 28% of insured adults. Underinsured means that you have high out-of-pocket expenses relative to your income. So for low-income families, it means spending 5% or more of your income on healthcare. For higher income, it's 10% of your income. So again, high deductibles. And we can look at some information on this. So it goes beyond those numbers. If you look at the bottom there, this is share of U.S. adults reporting problems with paying medical bills. And, you can look at that as huge numbers of people who are experiencing a coverage gap, who are really struggling. So the uninsured can't pay for their medical bills, but there's a significant portion as well of people who are insured who can't either.